I want to introduce myself. I'm Dr. Rita McGuire, and I am the Chief Medical Officer here at Wakana. I'm one of the co-founders. And what we do every Wednesday night is that we talk about a topic. We've talked about many, many topics, and then we take that information and we look at how CBD can assist with the symptoms of many, many challenges. Many of us are challenged with anxiety, with depression, with pain, with inflammation, with insomnia, with hypertension, with diabetes, with lupus, with fibromyalgia, with sickle cell anemia, with a gout, with sciatica, with neuropathy. I can go on and on and on and on. And what is really exciting is that CBD, cannabidiol, can address symptoms that really challenge many of us with hundreds and hundreds and hundreds of ailments. You know, in fact, when you look at the plant cannabis, cannabis-based medicine was used for over 60 years. You know, companies like Pfizer and Park Davis and Eli Lilly, all of these same pharmaceutical companies that we know today, guess what? They use cannabis-based medicine to address these symptoms that we're facing today. Yeah, with arthritis and diabetes and hypertension and insomnia and pain, for childbirth. You know, I'm an obstetrician gynecologist, and they use cannabis-based medicine for contractions to help ease the pain of labor, to help ease the pain of those monthly cramps, menstrual cramps. So this is nothing new, but what it is cannabis is really mainstream now. We really understand through science, through data, through research, not some magical potion, but through science, through data and research, that this plant has medicinal benefits that many, many can take advantage of. So if you know someone that is looking for a organic option, a holistic option, a natural option, an option that is outside of traditional pharmaceutical medication, then you want to invite them to these calls. You want to invite them to the information that we share pretty much every single night of the week, so that they can understand that this plant that really still has a negative stigma. Like when you say the word cannabis, what's the first thing that comes to your mind? Be honest. It's getting high, right? And no, we're not talking about the part of the plant that gets you high, the marijuana part. We're talking about the hemp part. We're talking about the part of the plant that gives you medicinal benefits without the high. So tonight, we're going to talk about a lot of things, right? We're going to talk about blood pressure. We're going to talk about stroke. We're going to talk about kidney disease, and we're going to talk about CBD. And then at the end, we'll be able to, you know, open up the line. And maybe you have questions as I'm presenting. Put your questions in the chat, and then we will get to all of your questions at the end. Well, I'm sure the first question that you may have is, what is CBD? Many of you who are new to the line, CBD is an abbreviation for cannabidiol. And cannabidiol can be extracted from the hemp plant. And when it's extracted from the hemp species, it is non-psychoactive, so it doesn't give you the high. CBD can also be extracted from the marijuana plant. Now, the marijuana plant, that's a part of the plant that gives you the high. Why? Because the marijuana plant has high levels of delta-9 THC, or delta-9 tetrahydrocannabinol, which gets you high, and very little CBD, where the reverse is true of hemp. See, hemp has a large amount of CBD and very trace amounts of THC. In fact, it contains less than 0.3% of THC. CBD is really mainstream. I mean, you can find CBD everywhere, quite honestly, from gas stations to smoke shops, to beauty shops, to video stores. Yeah, there's some video stores out where I live that sell CBD. It's everywhere. And it's everywhere because it's mainstream, so much so that folks who are looking for alternatives to their health and their wellness know that CBD can give them that. So there's all sorts of ways you can consume CBD. We're going to talk about different products. CBD comes in capsules, it comes in vape cartridges, comes in topicals, lotions, edibles, spices, butters, shampoos, face serums, coffees, teas. But we do know that the science shows that CBD can help to reduce pain, inflammation, arthritis, multiple sclerosis, Parkinson's disease, epilepsy, mental disorders. There's even emerging evidence that shows it can help treat and relieve symptoms due to high blood pressure, stroke, kidney, and other related diseases. And that's what we're going to touch on first is hypertension, high blood pressure. Many of you on the line may be on medication that you take for hypertension, lisinopril, metoprolol, atenolol. There's a lot of different blood pressure medications, Procardia, labetalol. Those are the two that we use mostly in OB-GYN, but know that hypertension is absolutely a disease that can be silent and can be fatal, right? If you have hypertension and you do not take your medicine, that can lead to complications like heart disease, heart attack, and stroke. And it can often be worsened by diabetes. So if you have diabetes, if you have high cholesterol, and you tack onto that high blood pressure, it really is a very, very serious array of conditions. Hypertension is very common and prominent in the African American community for many reasons, genetic reasons, cultural reasons. You know, we tend to eat a lot of processed food and fried food. We tend to be overweight and smoke and drink. And it's just part of our lifestyle many times. But it's something that we have to pay attention and really turn the other way to a lot of these unhealthy lifestyles. What are some of the ways that we can lower our blood pressure or even prevent from having high blood pressure? Reducing stress, toxic relationships, toxic people, or maybe the job you work at is toxic. Reducing salt intake, reducing alcohol and tobacco consumption. You know, the way I feel about alcohol and tobacco, if you're smoking and drinking, really seriously think about using our products, because there's a lot of research and data that shows that using CBD helps to reduce the cravings for alcohol as well as smoking tobacco. Increase your activity, regular exercise. You know, I exercise and work out about 5 days a week or 6 days a week. It's getting warm in the Midwest. Just walking, you know, will help to reduce your blood pressure. Eating healthy, eating more healthy fruits, vegetables, foods that are not in boxes and bags. Those are processed foods. You want to get away from those because they're high in sugar, they're high in salt as well. But making sure that if you're on medication for your blood pressure, make sure that you continue to take those blood pressure medications. There's evidence that shows that CBD, cannabidiol, can decrease blood pressure. It does that because it's a vasorelaxant. It helps to dilate those vessels, to improve blood flow to vital organs like your kidney, like your brain, like your reproductive organs. So consult your physician if you are on high blood pressure medication and you want to take CBD. Absolutely, you can do that. So not only is CBD a vasal relaxant, but it also helps to lower cortisol levels. Cortisol is that stress hormone. I'm telling you, I bet cortisol levels were sky high during this global pandemic. So cortisol levels can raise your blood pressure. That's why you always want to bring that stress down. In fact, there was a study that they did in the Journal of Clinical Investigation that showed that a single dose of CBD, 600 milligrams, that was administered helped to reduce resting blood pressure, right? So it really helped to go in and get those receptor sites that are in our blood vessels to help dilate the blood vessels. CBD also helps reduce the stress. Sometimes your blood pressure can be spiked up because you're stressed out. It helps to reduce cravings. It helps to lower that anxiety, helps you sleep better. All of these things are important when we talk about improving our blood pressure. We talked about lowering anxiety, reducing inflammation. Inflammation is a culprit in high blood pressure. The inflammation in those blood vessels increase the blood pressure as well. So CBD helps to reduce inflammation. In fact, it is a very powerful anti-inflammatory agent, CBD. It's also an analgesic, right? We can have, we see in our moms who are in labor, our moms who have had C-section, many times postpartum, their blood pressure may spike just because they're having a lot of pain. So reducing pain, CBD is a great analgesic. It improves sleep. We know that the quality of your sleep and overall general wellness plays a role in your blood pressure, plays a role in the cortisol levels that our adrenals produce. Well, let's move on to strokes and CBD. You know, stroke is a result of blocked blood flow. It's a decrease in blood flow to probably a very important organ, our brain. And this happens when essential nutrients and oxygen just cannot make it to these delicate cells in the brain. This can potentially damage nerves. It can potentially cause death and long-term effects. And what we know is that CBD has very protective effects on the brain. There are receptors in the brain and the central nervous system that's actually looking for CBD to help to protect the damage that a stroke has had on the brain. It protects the neurons. It helps to improve blood flow. It helps to reduce blood pressure. It even helps to reduce a chemical called glutamate. Glutamate toxicity, where CBD can come in and protect those neurons and even have an effect, if you catch it early, have an effect to repair and to regenerate those damaged nerves in the brain. CBD also has been found to promote a faster recovery. So those who have had a stroke, as they are in that recovery stage, there's data that shows that you can help them recover faster while using CBD. Kidney disease is another big issue in our community, right? Our community is plagued with obesity, with hypertension, with heart disease, stroke, and kidney disease. Right now, there is a dialysis center on every other block here in Chicago. There are more dialysis centers than there are McDonald's and Walgreens now. Why? Well, there's a lot of reasons why. One, we're seeing an increase in kidney failure in folks who have had and use long-term use of over-the-counter medications like non-steroidal anti-inflammatory drugs. Those are your Motrins, your Aleve, your ibuprofen, right? Can you imagine every time you have a pain or a headache or an ache, you take Tylenol? and you do that for 20, 30, 40 years, the impact that has on your kidneys, well, we're seeing that impact right now. We're seeing a lot of dialysis centers that are popping up everywhere because of long-term use of these medications. And we see in the United States, kidney disease is the 9th leading cause of death. It's estimated that 31 million Americans are diagnosed with chronic kidney disease. And they suffer from symptoms such as nausea, vomiting, sleep problems, loss of appetite, muscle cramps, swelling of the feet and ankles, and chronic pain. So this is an issue that we have to address, and we can address it with CBD. Kidney disease and CBD, there's a lot of data that's still ongoing. We can never say that if you have kidney disease and use CBD, it's going to reverse your kidneys, it's going to bring your kidneys back to normal. No, that won't happen. But what we have found is that there are benefits to those that take CBD and have kidney disease. Some of the side effects that we see with kidney disease is pain. CBD helps to reduce pain. We have studies that say that it can't reverse kidney disease, but CBD may slow the progression of kidney disease. CBD, we talked about, is an anti-inflammatory, so it helps reduce the inflammation in the kidneys. It can also help to protect the kidneys from oxidative damage. See, oxidative damage is very, very detrimental to every organ. Oxidative damage not only can damage your kidney, but your eyes, your liver. Oxidative damage comes from free radicals in the body that attacks your body. So CBD comes in and it will help to reduce those free radicals from damaging our organs. So a lot of evidence with CBD, and it relates to stroke, hypertension, and kidney disease. So when we talk about CBD and using CBD, it's really important to start low and slow. Many people get excited after hearing all of the benefits on how CBD can help them, but you want to start low and slow because many times you may not even need that much CBD. That's why we say start with a low dose. 3 drops in the morning, 3 drops in the evening is a great way. And there's a lot of factors that impact the effectiveness of CBD. Because another question is, well, how quickly will this CBD work for the issue and the challenge that I'm looking for results? Well, it really depends on the concentration. And we're going to talk about the concentration of some of our products. It depends on your weight. Right? If you weigh more, 9 times out of 10, you may need more CBD. It really depends on the severity of the issue being treated. If you have long-term arthritis, you've had it for 30, 40 years, well, don't expect a CBD product like we have here at Wakana to work in a day. It may take a little longer depending on the severity of your issue. It depends on your body chemistry. It depends on your diet. If you have a diet that is not so stellar, you're eating a lot of processed food, a lot of fried food, a lot of fast food, your diet is going to slow the process of CBD. So a diet that is fresh fruits and vegetables, a diet where you're eliminating a lot of red meats, a diet that is incorporating more fish and lean protein in the diet. And then your tolerance to CBD, meaning that your tolerance may be low. So start low, start slow, so that CBD can be effective. And then the question is, how much CBD oil is enough? You don't need a prescription to use CBD, but you do want to consult your physician. If you're on medication, you want to talk to your doctor. Let your doctor know that you're using CBD. Why is that important? Well, it's important because CBD really does work, especially the products here at Wakana. So if you're on blood pressure medication and CBD is in your system, it's going to help reduce your blood pressure. Well, your doctor is going to want to know, why is your blood pressure now in control? Why is your blood pressure improving, right? Why is it that you're not needing as much blood pressure medicine? You want to let your doctor know so that he or she can start reducing medications that you're on. So you want to wheel in your physician, let your physician know that you're using CBD so that they can start working with you to decrease and maybe even eliminate a lot of the medications you're on. So let's talk about our products here at Wakana. You know, as Chief Medical Officer, it is my duty to ensure that these products are safe, these products are effective, and these products are tested. So yes, our products are tested. We take our products through a third-party validation to ensure that there's no mold, mildew, heavy metals, no pesticides in our products, that our products are sourced from hemp. Our farms that we source our products from are growing hemp organically. That's really important because whatever is in the soil could end up in your product. And we would not want any harmful products, byproducts in our products. And that's important because if you're immunocompromised, if you have an immunodeficient sort of challenge, HIV, AIDS, autoimmune diseases, cancer, those pesticides, heavy metals can be very harmful, could kill those type of people, right? That have an immunocompromised immune system. That's why it is not a good idea to purchase CBD products from the gas station, from smoke shops. 9 times out of 10, these products are not tested. So not all CBD is made equally. Our products here at Wakana are tested. So they're safe and effective. We have smokables, we have tinctures, we have edibles, we have topicals, we have products for the hair. We even have products for those who have sexual dysfunction issues as well. Our disclaimer is that we cannot make any claims that CBD will cure, mitigate. We can't even make any diagnosis, right? Because CBD is not FDA approved, but we do know that down the line, the FDA will require every single CBD company to test their products. Well, we are way ahead of the game here at Wakana. Our products are tested, our products are verified, our products are safe, and they are effective. So let's talk about our tinctures. Tinctures are products that you use underneath the tongue. We have a power line and a pure line. Our power line is our full spectrum line, which contain the legal limit of THC, which is 0.3% or less. Our pure line is our broad spectrum line containing less than 0.0% of THC. So our pure line is a line for you out there that want to use CBD but may have random drug screens at your job. So you want to stay with our pure products. Those are the products that will not show up positive in your drug screen. So our Power 500 milligram, our Hempranium, that is the product on your very far left, is a product that has a proprietary formula that we are so proud of here at Wakana. We have added and enhanced this CBD product with the black seed, with turmeric and peppermint. Why do we choose these particular essential oils? Well, these particular essential oils not only enhance the anti-inflammatory properties of CBD, but black seed has been shown in research to repair and to rebuild the beta cells of the pancreas. Those are the cells that help to produce insulin. So that just essential oil is really helping those that have type 1 and even type 2 diabetes. So our tinctures are used in the morning, 3 drops in the morning, 3 drops in the evening, again, starting low and slow, knowing that you can increase if needed. If you need to increase, I recommend increasing that dose after 4 days. After 4 days, you can increase that dose to 8 drops twice a day. If you need to, the maximum dose of our products is 15 drops twice a day. Now, our Power Water Soluble, that product in the middle is a great product that I like adding to my water. It's a product that you put in liquid. See, oil and water don't mix. So we have a formula that you put in liquids, in your tea, in your coffee, in your water, in your smoothies. So that way you can get the product in and go along with your day. Now the water soluble, I love using in those grandmothers, grandfathers, anyone that has a cognitive dysfunction, they have dementia, they may have Alzheimer's, they may have Parkinson's. This is a great way to put it in their food, put it in their juice or coffee, and they don't have to hold that oil underneath the tongue for a minute. That can be kind of challenging for that patient population or that person. We also have tinctures that address alopecia, that address hair thinning, that address hair loss. That's our empowered hair. This is a great product that you can use underneath your tongue, but if you are challenged with hair thinning, hair loss, and you have random drug screens at your job, then you can put this product right in your hair, right on the edges. You know, we see people who are hypertensive, those who have kidney failure. They have issues with hair loss. It may be because of the side effects of the medication, or it could be from side effects from the dialysis. So these are great products as well. When we talk about the benefits overall, when you use a tincture, we're talking about the benefits of reducing inflammation. We're talking about the benefits of being an antioxidative, addressing those free radicals. We're talking about improving overall emotional well-being. We all need that, right? Oh my gosh, it's just been a year and a half. Improving memory, helping with digestion, helping with kidney, liver, blood glucose, cholesterol, skin damage. This synergy of CBD along with the black seed, turmeric, peppermint, our carrier oils that we use, MCT and hemp seed oil, overall have an amazing benefit on a cellular level. And then let's move on to our topicals. Topicals are a really, really great way of offering local relief to those who have discomfort. And what I'm looking for right now in my little pouch, see, in my little pouch that I carry with me everywhere is my topical and my cartridge we'll get to. What I love about topicals is that one, they don't pass through the blood-brain barrier. So if you have random drug screens, you can still use our power topicals. But what I also love is that they're very, very handy in that you can just rub on that Dr. Rita's rub because it's in a roller ball and go about your day, not having to wash your hands because you've got the cream on. So for me personally, I use our Power Extreme Pain Cream. Personal, I use it at night. I let that cream set into those sore, achy muscles and joints after working out. I use the Dr. Rita's rub whenever I need during the day. I just rub it on those sore areas because it's able to carry it very easily. I love the 500 milligram. I love that because it gives you more of a bio-freeze sort of feeling. It is a great for after the workout. You know, I've got something for before the workout, after the workout, and at night when I'm sleeping. We also have a topical lotion, our our mango body cream. A lot of people are using this body cream when they have aches and pains too. Why? Because it has 500 milligrams of CBD in it. It can address conditions like eczema, acne, psoriasis. We have so many products that actually help to get you in the mood too, that are topical products. We have our Pure Seduction line, as well as we have a facial serum. This facial serum I use daily, twice a day, in the morning, in the evening. Why? Because CBD has receptors in the skin when we're talking about reducing the aging process, wrinkles. Nobody wants wrinkles, right? Especially not us women. So helping with the collagen in the skin, helping to reduce inflammation. CBD also helps to reduce bacteria. So we know that acne is a result of a bacteria infection as well as inflammation. So all of these topical products, oh, and our oud oil is amazing. Our oud oil, our body glow, is a great way to use on all over your body, especially now that it's getting hot outside. We're perspiring more, just adding that moisture back into the skin. So again, here are so many of the benefits of the topical products, just replenishing moisture to dry skin, addressing issues like aging, acne, eczema, addressing issues, again, topical with the hair, and again, with pain and inflammation. Now, our edibles are really our popular items that fly off of the shelf. We have a flat belly coffee brew that has our CBD in it. It is a great way to help those who want to maintain or lose weight. It helps to reduce our cravings for carbs and sugar. We understand that drinking coffee is not going to be magical and make you lose weight, right? You got to do more than just drink that coffee. We have to have a very disciplined lifestyle with this coffee, and we help you with that. We have to engage in activity. We help you with that, exercise. Our gummies, we have gummies for those who have random drug screens, our pure gummies. We have our power gummies. We have our Delta 8 gummies. We have gummies that help you get in the mood, stay in the mood, give you that sexual stamina. We have immune defense tea. We have a bitter tea. We have a lot of products that address inflammation, that address pain, that address sexual dysfunction, that address detoxification, that address weight loss. We have not missed anything with our products here at Wakana. Just know that the Delta 8 gummies are the new kid on the block. Delta 8 is a very close cousin to Delta 9. So if you like Delta 9 and you like THC, you will like Delta 8 because it gives you the same feeling of a Delta 9 product without the high. And that is very important that you understand that none of these products give you a high. None of these products give you a paranoia, a euphoria. These products are sourced from hemp, meaning that they do not give you the high, they give you the health without the high. So these are great products. When you start edibles, it's the same frame when you start tinctures. Start low and start slow. You never want to just eat a gummy and eat another gummy and eat another gummy, right? Because you're like, these gummies are not working. Gummies take about 45 minutes to 90 minutes to get into your bloodstream. Tinctures take about 15 to 20 minutes to get into your bloodstream. Topicals are pretty instant, 1 to 5 minutes to have an effect topically. So with gummies, You want to start low, start with a fourth of a gummy if it's Delta 8, start with half of a gummy if it's a CBD gummy. Wait 45 to 90 minutes before you partake in more of the gummies. Again, these are the benefits. Benefits of gummies are the same benefits that you see for CBD overall. So if you're looking for help with assisting with symptoms that you may have due to inflammation, pain, hypertension, heart disease, maybe you know someone, or maybe you've had a stroke, or maybe you want to prevent this from all happening, same benefits. Reducing inflammation, being a very powerful antioxidant, helping to address those free radicals that can tear our body apart, helping with insomnia, helping with anxiety, helping with depression, helping with shingles, helping with viral infections, helping with bacterial infections. The list goes on and on. Our essential oils are really a great way to address our wellness in an organic way. Essential oils can be used topically, they can be ingested like our black seed. I recommend that if you have chronic comorbidities, hypertension, diabetes, asthma, lupus, fibromyalgia, you've had a stroke, you have high cholesterol, that you absolutely get a bottle of black seed and you take that in addition to CBD. Black seed does everything. What doesn't black seed do? It helps with the kidney, liver, cholesterol, skin, hair. It helps to rebuild the beta cells of the pancreas. It helps to get that insulin to not be resistant in type 1 and type 2 diabetics. We have an essential defense, a first defense. Our first defense is a nasal spray that contains not only essential oils, but CBD. You're getting that CBD right at the entry point of viral loads that come from COVID or come from the flu virus. From these viral loads, using CBD nasal spray is a great way to protect your body. Again, many, many essential oil benefits. Peppermint, I love using peppermint to give me energy, right? So instead of using Red Bull or all those other energy drinks, I put peppermint on the soles of my feet every single morning. Every single morning, I put peppermint on the soles of my feet. You may ask, Dr. Rita, why would you put peppermint on the soles of your feet? Well, the soles of your feet have the largest pores in your entire body. So if you want something to get absorbed in your bloodstream, you should put it on the soles of your feet. You can put any of the essential oils on the soles of your feet. I put peppermint because it gives me energy. Our smokables, you can see here I have my cartridge. I love the hypnotic cartridge because it is a great way for me to get CBD into my system within 1 to 5 minutes. Today, IDPH, the state, the regulatory body, was at our hospital. I was stressed out. So I used my cartridge, 1 to 3 pulls. It really helped me to be very calm while IDPH was in the house. Our Raspberry Jane is a great cartridge for those who like a raspberry flavor. We also have our Delta 8 cartridges. For all of you that really love THC, you'll love our Delta 8 cartridges. We have a smokable, a CBD joint. So for any of you out there that smoke cigarettes, this CBD joint will help take away, reduce the cravings for nicotine. It's a great present that you can give to every single person in your life that you know that smokes and you want them to stop smoking cigarettes. 1 to 3 pulls 3 times a day is all you need. And then we have premium flower because we know that some folks like to roll their own CBD joint. So these are great, great products for those who want to get CBD quickly into their bloodstream. It works very quickly. You don't need a lot. 1, maybe 3 pulls is all you need. Again, now the benefits with the smokables are also that it is more available to the cell. On a cellular level, when you vape or smoke CBD, it's about 60% bioavailable to the cell. So there's a higher rate that's getting to the cells, and it's getting there quickly. We have culinary products, we have spices, we have butter. We even have a product called our Culinary Plus, which you can bake with, you can cook with. It also can be used as a tincture. So this is a great tincture for those who don't like the black seed or turmeric or peppermint in their tincture. Obviously, when you're baking and cooking, you don't want to have all those flavors. So this is a unflavored product that you can bake and cook with. When you're baking and cooking with CBD, you want to be mindful not to cook over the degree of 350, because when you bake or cook something that high or higher than that, you can bake and cook off all the benefits of CBD. You don't want to bake off all your money, right? And it also can cause a bitter taste. So when you bake and cook 350 degrees Fahrenheit. Again, the same benefits in our culinary products are found in all the products. Why? Because they contain CBD, reducing inflammation, pain, anxiety, helping you to sleep. Just a great creative way to get CBD in the kitchen. Our hair care system contains CBD. Why? Because the hair follicle loves CBD. The hair follicle can be damaged by our hairstyles. It's called traction alopecia. The hair follicle can be damaged by stress. We see in moms who have babies, right? Typically that postpartum time, their hair falls out. The hair follicle does not like autoimmune diseases. A lot of the medications that folks are on, if they have renal failure, if they have hypertension, if they've had a stroke, they have hair thinning and hair loss. This whole system helps healthy hair to be regained. We have a whole system of shampoo, conditioners, detanglers, styling cream, even products for men and their beard and our empowered hair. These topical products will not pass the blood-brain barrier and can be used very safely for those who have random drug screens. Again, these products are nourishing. These products help to reduce inflammation in the scalp. These products help reduce bacteria in the scalp. These products are organic and very, very helpful for those who have thinning. We have products that we use in our home, sanitation products for hard surfaces, for our hands, for our produce, for our meats. These are important to couple with all of the CBD products, tinctures, the essential oils, because we are still in a global pandemic. So we have thought about everything here at Wakana. Those are some of the benefits. You know, our products use quaternary ammonium that kill 99.99% of common germs that cause illnesses, reducing bacteria, viruses, etc. We have sexual health products. We know our sexual health is important, right? Right now, we are delivering lots and lots of COVID babies. But how about the baby boomers? How about that woman that's menopausal, that's having hot flashes and mood swings and changes in her libido? How about that guy out there that has erectile dysfunction, has issues with stamina? Well, we have products for those. CBD sexual health products that help to restore the vagina, to help reduce the vaginal dryness, that help to enhance the sexual organs like the clitoris, to help men in their stamina, men who are hypertensive, diabetics, they deal with erectile dysfunction. So we have our CBD gummies, we have sensual and sexual aftershave balm, we have body creams, We have a G-spot lube. We have a CBD lube for women to really help to enhance their libido, to enhance their sexual function, and to really have a healthy sexual life. So again, CBD does not stop just with the hair, with inflammation, the heart, the kidneys. Our reproductive organs need CBD as well. And again, recommended dosing is on all of our products. Start low, start slow. You can always increase. So the recommended dosing for our tinctures are 3 drops twice a day. Our recommended dosing for our gummies, start with a half or a fourth and then increase 45 minutes. Our dosing for essential oils, 1 to 3 drops, 3 times daily. You can dilute them. You can put them on the soles of your feet. Our topicals apply to affected areas as needed. Do not apply topical products to open wounds. Not a good idea. To open skin, not a good idea. Do a test dose. Always use a small dose first before applying over large areas. Our smokables, 1 to 3 pulls on your cartridge or your pre-roll is all you need 3 times daily. Our spices, you don't need a lot, 1/4 of a teaspoon per serving. And then our hair care system, our sanitation system, use as directed. So there's so many great choices here at Wakana. You can't go wrong. I recommend layering these products. That means using the tincture along with the topical, along with the smokables, along with the edibles, making sure that CBD is in your system throughout the entire day and night so that you get the relief that you're looking for, so that you get the ability to improve your quality of life with a natural, organic way of healing, and that's with CBD. So I want to thank you for your time. My email is there. It is ritamd@wakana.com. So I'm going to stop sharing my screen now. We're going to take some questions for the audience. Let's see what we have in the chat box. You can put it right there in the chat box if you're having questions. Right now, I don't see any questions in the chat box. I'm going to go over to the Q&A. There's no questions in the Q&A. I'll give you a couple of minutes to put some questions in there before I say good night. But if you're a guest on the line, I want you to connect with the person that invited you so that you can get your products ordered. We will just ship them directly to your home so that you can start using these amazing products. We want you to share this information with your family, with your friends, with your coworkers. See, our whole mission and vision here at Wakana is to end the negative stigma that surrounds this plant. Many, many people, including myself, did not realize that there was a part of the plant that gave you the health without the high. The only thing I knew about cannabis was weed, getting high, right? Because I've got 3 children that partake in cannabis. But now I know that there is science behind how CBD works. There's science behind how this plant offers healing to everyone. So any questions, put it in the chat. I don't see any questions. I guess that's a good sign. I'm not sure. Oh, what is the shelf life of the vegan butter? The shelf life of the vegan butter is 6 months. You want to keep that refrigerated, of course. The other product you want to keep refrigerated is the water-soluble product. That should be in a refrigerator. Outside of that, the shelf life of our tinctures is a year. The shelf life of the edibles are 6 months. You want to keep your products in a nice, cool, dark place. You don't want to keep products in the direct sunlight, in your car when it's 90 and 100 degrees now. It's getting hot. A nice, cool place. I keep my products in my pantry. I keep my water soluble in my refrigerator. Funny story about the vegan butter is that my daughter, for some odd reason, thought it was body butter. I'm not sure who keeps body butter in their refrigerator, but this girl put my vegan butter all over her body. So vegan butter goes into the refrigerator. It is used to put on your toast, put in your oatmeal. It is not a body butter. Oh, thank you, Anita. Any questions? Oh, there's a question, I think, in the Q&A. What product would you recommend for a type of dermatitis of the scalp? So dermatitis of the scalp is inflammation of the scalp. Many times that inflammation of the scalp can be due to a bacterial origin. So what you want to do with the dermatitis of the scalp is you want to have that evaluated. You definitely want to go to your primary care physician, or you want to go to a dermatologist. But in the meantime, as you're getting a formal diagnosis of what's going on in your scalp, you absolutely want to use CBD. You want to use the Hempranium 500 milligram tincture. You want to put that tincture 3 drops in the morning, and you want to put 3 drops in the evening. You also want to use the gummy. The gummy at night is going to address inflammation that's going on in your scalp while you sleep. I would not recommend putting any topical on that dermatitis until I know what your physician, your dermatologist, or your primary care physician has diagnosed you with. In the meantime, you're going to use the tincture twice a day underneath your tongue. You're going to use the gummies at night to reduce that inflammation, and you're going to get a formal diagnosis. Once you get a formal diagnosis, there's nothing weird going on, right? You want to then use our SOS, our hair care line, and our empowered hair product. But I always like when there's something that is going on with the body, let's find out what it is before we put a topical product on that. But definitely you can use the tincture and you can use the gummies in the meantime while you're waiting. Is the immune defense tea and bitters the same? No, the immune defense tea is a tea that is great to help to boost your immune system as we are still in this global pandemic. It's got a great amount of organic herbs that are helping those immune glands like the adrenal, like the thymus, really helping to build your immune system, right? So that immune defense tea is something that you want to drink on a regular. Now the bitters is a detox. It's a 4-day detox. And why should you detox? Well, you should detox because toxins that build up in the liver, toxins that build up in your brain, these are really important organs that need to be detoxed. The liver can excrete and remove toxins that are built up through environmental toxins like the pollution and air we're breathing, toxins that are found in food. I don't know if any of you saw my post that I put about Chick-fil-A. You know, half of this food in fast food restaurants, they're not even real. It's not even real food. It's like made up chemical foods. So we need to detox at least quarterly. There's some people that need monthly detox. It's a 4-day detox. It's a tea that you make. You drink 8 ounces every day for 4 days, or you do 4 ounces twice a day for 4 days to help cleanse that colon and to detox that liver. So there are 2 different products. Both products highly recommend that you use. Great question. What products should a person with high blood pressure start off with? Once approved by the doctor, they should start off with the 500 milligram tincture, our Hempranium 500, twice a day, 3 drops in the morning, 3 drops in the evening. If they have random drug screens at their job, use the pure product. That should be layered with a edible at night, a gummy at night. Those are the 2 products right out of the gate if you have high blood pressure that you want to start out with. Should a person on dialysis use the bitters? So what you want to do when you are a patient on dialysis, you always want to talk to your nephrologist about your products, right? Because dialysis patients, there's many levels of dialysis. There's some patients that are dialysis that are very early renal failure versus later long-term chronic renal failure. So you want to talk to your nephrologist before using bitters, before using CBD products. See, here at Wakana, we never want to be your doctor, right? Because I'm a doctor, I'm a real doctor, but I'm not your doctor. So you always want to get your approval from your doctor. You want to give them the information, let them know that you want to use the bitters, you want to use the CBD, but you want to ensure that you're not on any medications that could increase or decrease the effectiveness of your treatment, your pharmaceutical treatment that you're on, okay? Doesn't mean you can't take bitters, doesn't mean you can't take CBD. It just means that you need the engagement of your physician to know what you're doing.
Dr. Rita, there's a question, I think, from Mom Mitchell regarding the difference between 400 milligrams and 500 milligrams topical.
Very good question. So we have a 400 milligram topical, we have a 500 milligram topical, and then we have our Dr. Rita's rub, right? Which is a different formulation, 200 milligrams. So each product is very unique, and it's unique by the fact that we've enhanced all 3 products with essential oils. We've enhanced the 400 milligram product with 8 different essential oils. The 500 milligrams has 6 different essential oils, and the Dr. Rita's Rub has like 19 essential oils. It depends on the severity of your condition. It depends on your body chemistry, your diet, as to which product is for you. So that's why I use all 3 of the topical products. The 400 milligram has 8 different essential oils. The 500 milligrams has 6 different essential oils. The Dr. Rita's Rub has 19 different essential oils. So all 3 work differently. All 3 have different formulations. All 3 I use at different times. I use the Dr. Rita's Rub throughout the day, and I use it before my workout. I use the 500 milligram after my workouts. I use the 400 milligrams at night. So different people have different preferences, and it works differently on different people. See, Ma, who asked the question, Ma Jones, this Dr. Rita's Rub may work differently on you than me. Why? Because I may have more inflammation in my right knee than you do. So that right knee of yours may need a formulation that has more essential oils. Or your shoulder may need less essential oils and CBD depending on the severity, depending on your diet, depending on your weight, depending on your tolerance. It's just so many factors. That's why I recommend, my recommendation is to use the Power Relief Cream at night, so that cream can really set in at night. to use the Dr. Rita's rub. It's very mobile. You can carry it anywhere throughout the day. And the 500 milligram one after workout or after walking or after strenuous activity. I hope I answered your question. It's different strokes for different folks. Use all three of them and see how they work. I have some patients, clients, family members that use our Power Body Mango Cream. They use the Power Body Mango Cream and say that it works for their pain. So you can even use that as well. Yeah, the 200 milligram extreme pain cream is the same formulation as the 400 milligram pain cream. It's just in a smaller jar. So because it's a smaller volume, it's 200, and the larger volume jar is 400. It's the same formula. It's 9 o'clock, and it's time for me to go upstairs and deliver some babies. You know what happens on Wednesday. Dr. Rita has to go to bring new life and blessings into the world. Again, if you are a guest on the line, we want you to connect with the person that invited you. Thank you for your patience. Business partners, thank you for showing up, because each time you hear this information, you're feeling more comfortable in sharing the products with others. Be well, be safe, take care, and we'll see you next Wednesday evening at 8 o'clock. Email me. I know that I owe so many people some topics, but email me. Let me know what you want to hear from me. Let me know what's working for you or not. I take constructive criticism very well. We want to make sure that folks get this information. We want to make sure that physicians, healthcare professionals get this information so that they can care and offer organic options to their patients. Because quite honestly, patients are sick and tired of being sick and tired. And pharmaceutical medications are really not working very well. So this is a great option for those who are looking for an organic, natural option. So thank you so much for your time. We will see you next time. Be well, be safe, and God bless you all.